Welcome to the Rim Break Rodeo. We hope this video helps.
You begin by assessing cause and giving fast relief. Check whether pain was sudden or gradual, because the approach differs. Note swelling, numbness, and range of motion. Then, apply ice for 15 minutes every 2 hours for the first 48 hours to reduce inflammation. Always use a thin barrier. Once done, immobilize the index finger in a soft splint that keeps it slightly bent at its natural angle to avoid stiffness and protect injured tissues. You now progress to controlled movement and load management. If swelling has reduced by day 3, start gentle passive range of motion to maintain joint mobility. Stop before pain increases. Next, add isometric holds and then light resisted flexion using therapy putty or a rubber band to rebuild strength gradually. Make sure to modify daily tasks, reduce grip force, switch to ergonomic handles, and take regular breaks to prevent overload while tissues remodel and adapt over weeks. You finish by progressing to advanced rehab and knowing when to escalate care. Transition to eccentric strengthening, proprioception drills, and task-specific practice once pain is controlled. These restore tendon tolerance and coordination. If numbness persists, pain worsens beyond 2 weeks, or you experience locking or catching, seek medical review for imaging or specialist referral. Finally, consider night splinting for continued inflammation. Corticosteroid options are for clinicians to weigh if conservative measures do not resolve symptoms.
Thanks for watching. Consider subscribing if we helped you.